This one actually went down to a 1.02 relative risk, meaning there's only a 2% chance of me developing cancer, which is weird, huh? Just kind of makes you think that maybe it's not as strong of a causation, right? Maybe it's just a correlation. Now, from the 250 gram group was a 1.33, so that is a 33% increase. These are getting pretty big numbers again, but the reason I personally am not worried about aspartame in this case is that when we go from 250 grams to 500 grams, we double the amount of aspartame. The relative risk is now 1.30, so it went down slightly. That is kind of how I draw conclusions from this. And again, I'm not saying that those conclusions are perfect, but I would expect some sort of an increase in the relative risk of cancer by doubling an already obscene amount of aspartame consumption. Maybe you've already hit that upper threshold, so it's not going to increase very much. That's totally possible. But what you saw is it actually went down. Not to mention the group of 50 grams that was even lower than the group that just consumed 2 grams. What we're not seeing there is a dose response. We're not, usually for something to be considered a very strong causation,